Thank you all for inviting me here today. And hearing about the work of community access, it really feels like there's, as you'll hear, I'm going to talk about some of the work that we do at the Jed Foundation. There's a tremendous synergy. I actually have personal synergy. My father was the director of consultation education at the Soundview Throgs Neck Community Mental Health Center in the Bronx for many years. So I have historical roots in the community mental health universe. So, this feels like kind of coming full circle, as again does the work of the Jed Foundation. What I'd like to do in the next half hour or so is talk to you a little bit about the situation around late teen, young adult. I'm not a child psychiatrist, so I'm here a little bit under false pretenses, I have to say. My work really started out after 10 years working at Bellevue, and actually we were very closely engaged with Gouverneur Hospital, and some of our residents worked at Manhattan Psychiatric Center, so those pictures also were sort of historically resonant in not the most pleasant ways. My work has been primarily at the college level for the last 25 years. I was at NYU for many years as the medical director of the counseling service there, was then the director of the counseling service at Yeshiva University, and then was the dean of students there for 6 years. And really working as a dean of students, I quickly realized I might have been the only psychiatrist dean of students at a college in the country. But I quickly realized that what I was doing was effectively community mental health. And that really, I think, deepened my appreciation, as has my work at the Jed Foundation over the last 5.5 years or so, for what really needs to be done and at the community level, and how to think about mental health and providing care for people with mental health challenges needs to be done more than just in a therapist's or doctor's office. So again, I think you'll hear that while we're coming at it from slightly different directions, there's a lot of synergy in what we're doing. Just a couple of words about the state of mental health in general. Some of you may or may not know, I don't know, that this year is declared by the World Health Organization a year dedicated to conversations about depression. Every year the World Health Organization actually picks an illness or a topic to focus on. So internationally, this is the topic of the year in the world of health. One of the things that they've pointed out is that there is more lost school and work time and more economic impact flowing from depression internationally than from any other illness. So, when people sort of brush mental health to the side, I think even now at the international level, health organizations are recognizing you can't do that. That it really is part of what needs to be considered. And, just one other point to put the broader issue in context. A number of years ago, the Institute of Medicine released a book on mental health care in children and teens, and one of the first points they made is that the biggest contributor to psychopathology in young people is poverty. And I think this came up in the work of the World Health Organization. They pointed to the number of refugees currently in the world as being a major contributor to the sort of astronomical and increasing rates of depression internationally. So obviously we're talking about a worldwide, at every age, serious and major health concern, and that's just depression. That's putting aside all of the other facets of mental health problems and challenges. So what do we know about the situation among young people? Well, I think in the little handout you got, this statistic of 1 in 5 young people have some kind of diagnosable mental health condition. That sounds like a lot, and it sounds very troubling, but think about the fact that if we ask people who have kids, how many of your kids in the last year have had some kind of medical illness? I think what you'd all say is, we'd probably come up with 30-40% have had some kind of diagnosable medical condition in the last year. So if we think about mental health problems along a continuum in the same way we think about health problems. People have aches and pains, that everybody's got blood pressure, everybody's got all kinds of things that when they hit a certain threshold become a problem, a medical problem. We all have challenges, we all have anxieties, we all have, sort of life stresses, which when they hit a certain point of severity, we start to treat them in a different way. So while we need to be cognizant of that number, it shouldn't particularly scare us or surprise us. So I think it's just important to keep that in context. We certainly know that many of the people who have serious troubles are not getting care across the country and internationally. These statistics are US, though. So 46% didn't receive any treatment of those who had a diagnosable condition. It's estimated that 11% of teens have had a major depressive episode in the last year. This is information that's a little bit older. The statistics around these things always lag a few years because it takes a while to collect the data. And what we are seeing across all of the areas of child and teen and young adult mental health is that the numbers appear to be getting worse. And I'll talk a little bit about why I think that might be the case. What are some of the contributors? For kids who were leaving high school, we did a study with the Harris Poll as part of a project we were doing, and 60% of those kids wish they had gotten more emotional preparation for the transition out of high school. These were kids who had gone off to college, so they felt they had not gotten as much preparation as they had wished. And one of the things we know that is obviously very concerning is that if you look at the two leading causes of death from age 15 to 35, the leading cause of death is accidents, and that's often driven by substance and alcohol use, car accidents, overdoses. The second leading cause of death across that whole age span, so from the mid-teen years to young adulthood, is suicide. Now, partly that's because this is a very healthy, medically healthy group of people. There aren't a lot of people dying from medical conditions at this age. Actually, in younger kids, there are medical conditions that lead to death. So there's things like neoplasms, cancer in younger kids is more common. Suicide is actually not so common below 15, although the rates have been going up in concerning ways. But at this age, again, suicide is the second leading cause of death across this whole span. In some of the age groups, homicide had been more common than suicide, but actually homicide rates have gone down. So, and suicide rates have crept up and overtaken homicide as the second leading cause of death. If you look at college students, which, as I'll tell you as I describe a little bit about the work we do, we have quite a bit of data about college students. We unfortunately don't have as much data about community college students, although I'll make a couple of comments about this group as well, because it's a significant portion of college students. But the American College Health Association does a twice-a-year survey of students attending college across the whole spectrum. And in the most recent survey, which is pretty recent, it's 2016 spring, so just about a year and a half ago, 3 out of 5 felt overwhelming anxiety at some point in the prior year. 1 out of 3 felt too depressed to function. 1 out of 3 had a binge drink within the last 2 weeks. So that's not across the whole year. 30% male, female were acknowledging that they had a binge in the prior 2 weeks. 1 out of 8 in the prior year abused prescription drugs. About 10% had serious thoughts of suicide in the prior year. Actually, that's a lower rate than what's reported by high school students nationally. 15% of high school students report serious thoughts of suicide in the prior year. Fortunately, there's a very big gap between thoughts of suicide and actually dying by suicide. But, on the attempts, about 1.5% of college students reported making a suicide attempt in the prior year, which when you think about a denominator of 21 million students, that brings you to a very, very large number. And it's estimated that about 1,400 college students died by suicide. interestingly, the rate of suicide among college students is actually lower than the rate of suicide among non-college attending people the same age. So although we're aware, and obviously it's tragic, and there are particular risks related to a suicide in college because of the risks of contagion in closed communities, you're actually safer being in college than not being in college. When we think about the community college universe, first of all, I don't know if any of you saw a few days ago, the president of LaGuardia Community College had an op-ed in the New York Times. She actually quoted some of the research that was done by friends of ours at the University of Michigan and Hope Lab, Wisconsin. They did a big survey of community college students, and the findings were distressing, not so surprising, but between 15 to 20% at some point in the prior year dealt with food insecurity or homelessness. That's kids in college. These are kids actively going to school. And 40% were working 30 hours a week or more. So many of the students in community college are holding full-time jobs down. Many of them had children. Again, you're seeing people in this universe where success is going to hopefully put them in a stronger footing in terms of life success, are dealing with multiple stresses. Just a couple of other quick comments about college students. The group at University of Michigan, there is a researcher there in public health who's done probably more work than any other individual in looking at the mental health of college students. His name is Daniel Eisenberg, and they've broken down by race and ethnicity some of the findings around mental health in college students. And a kind of curious finding has come up that among black college students, rates of anxiety are slightly higher than national norms, but rates of depression are slightly higher, but rates of anxiety are actually significantly lower. Rates of suicide attempts are lower, and rates of suicides are lower. And it's not clear. One of the other, on the negative side, rates of asking for help are also lower. So there's, as there are among many marginalized groups, real reticence about asking for help when in difficulty. But at the same time, there are suggestions, people have suggested, namely me, that it could be that the African-American students who are getting to college are actually more resilient than the average student who's just sort of floating into college as just part of the sort of usual course of events. That it's requiring a real sort of deliberateness and resilience and grit that may not be there for the sort of just general other college students. So just something to ponder. Getting away from college students, why are kids looking worse than they were 20 or 30 years ago? What's going on? And I don't think anybody knows the answer to that, so that puts me in the nice position of being able to speculate, and you can't prove that I'm wrong. So I'm gonna make a couple of suggestions, which I've certainly thought about, and I think most of these have at least some support for them. In the last 17 years we've been living, and by the way, I just want to comment that we've seen suicide rates, and I think that's a real indicator of social stress. Suicide rates have been going up in the United States in almost every age group since 1999. Now, I don't want to get into too much of the details of that, but something seems to have happened in 1999, 2000, and they started going up more dramatically after the market crashed in 2006. So a couple of things we know. There have certainly been changes in the way healthcare has been paid for before the Affordable Care Act came into play. Mental health was being shortchanged dramatically. Managed care, that period, the lack of parity in the way mental health care was being covered, I think created drastic shortages in the mental health workforce and the mental health system across the board. It was difficult to get funding for stuff, and I think we're still really seeing the the outgrowth of that really kind of social disaster in a certain way, that the free market really didn't manage the insurance system for mental health care properly. Clearly, the society has dealt with a number of stresses in the last 17 years. The world changed on 9/11. We've been at war. Since then, the economy has, I think, felt more and more divergent for middle class, and people below the middle class have certainly felt less stability and less optimism about the future through much of this period. I think people are uncertain, and this is we see impacting college kids and even high school kids. There is greater uncertainty about what jobs will look like in 20 years. So colleges have become more expensive, even in the public sector. The states are funding colleges at lower levels, tuitions have gone up, and young people are more uncertain about what sorts of jobs, even not just what job they'll have, but what ranges of careers will be open to them. And been a lot of stuff going on, right? So there's been all of this social upheaval, and for young people, there has been the need to integrate social media. So what impact, we're engaged in a massive social experiment, really that's changing the way people communicate, changing the way people grow up, changing the way people are getting information. And I don't want to blame everything on social media that we're seeing with young people, because I think that there are many positive uses for it. But at the same time, it has clearly made things uncertain and challenging in ways that are very new. There are a couple of bright points, though, and some positive things to say about social media as well. In some ways, getting access and broadening ranges of communities and communications, and I don't know if this is social media, if this is a function of just where society is evolving, but we're finding that young people are more open, more socially accepting, more tolerant than prior generations in many ways, and that's true around mental health as well. So when we talk about stigma related to mental health, when you speak to young people, by and large, they're less hesitant about getting help than people were 10 and 20 and 30 years ago. They're more open to the idea of mental illness. I don't know if any of you saw, I wasn't watching, but I heard about it afterwards at the MTV Video Music Awards. A rapper named Logic has actually a rap piece, which is the phone number of the National Suicide Prevention Lifeline, which is extraordinary. So it's out there. I mean, kids are more and more aware of this stuff. I think, all of the work that probably all of us are doing is, I think, beginning to show some results and impact. We still know that kids will first go to their friends when they're in distress. And some of the things I'm going to tell you about are ways we're trying to leverage that piece of information. What we're trying to do at Jed, and I'm just going to have about 10 minutes or so to talk about that. So I'm not going to get into too much detail. You can look around our website, which is jedfoundation.org. So, take a look around. We've actually got 4 or 5 sub-websites. We've got a bunch of different kind of separate projects. Each separate project has its own website. What we're trying to do is equip teens and young adults with the skills that they need to help themselves and each other. And I'm going to tell you a little bit about how we're trying to do that. We're working with high schools through a program called Set to Go to try to address that issue of kids not feeling emotionally prepared for adulthood or college life. We've created this platform. We're beginning to work with schools to develop curricula around this. We work in a very intensive way with now approaching 180 colleges across the country, providing ongoing technical assistance around developing a community mental health system on their campuses. That's called the Jed Campus program. And we're really trying to work with communities to kind of spread understanding about mental health, doing stuff like this. our model, as you see, this came out of work done by the United States Air Force. In the 1990s, before we were at war, they were seeing an increase in suicides among service members. They got together a bunch of folks to talk about what do we know about suicide prevention. And they really came up with a kind of community mental health model of suicide prevention in the Air Force, which has been actually empirically demonstrated to be effective. Ironically, the papers written about it have been published in the British Medical Journal, not in an American journal. I don't know why that is. It just strikes me as funny that it's about the U.S. Air Force. I don't know. It's a strange thing. I'm not saying an American journal wouldn't publish it. I mean, they're very reputable people at the University of Rochester, but it's just ironic. And when the Jed Foundation was founded, one of the first things that happened was we got together some of those people in higher ed, and tried to understand what a system to address suicide prevention and mental health on a college campus would look like. And what came to understand is that if you look at the two top elements, the developing life skills and fostering connectedness, those are really the kind of main factors that we know either put young people at risk or help them really develop resilience and grit. We know connections are really an important factor. People who are isolated are at higher risk for suicide, actually for psychiatric illness in general, and in fact, for death of medical illness too. So connectedness is a really, really crucial factor. At 3 o'clock and 4:30, we really think of those two elements as how do you intervene early? How do you build a system where the system is identifying people at risk when they're in trouble, or the people who are at risk or are in trouble are most inclined to ask for help? So that really has to do with, lowering rates of stigma, making it easy to get help, making the help accessible and really responsive to their needs, making sure that services are available, which, obviously at every level, as I said, is a big problem, making sure that you have a system in place, and this is something that's, really pertinent when you see mass disasters like Hurricane Harvey. How do you deal with a crisis? Making sure you've got a prevention plan, a plan to deal with a crisis, and a postvention plan, which we can't forget about. Means restriction is sort of suicide focused, but thinking about environmental safety. What can you do to make sure naloxone is available, where it's needed, and what kinds of things can you do to create a more safe environment? So we've got about 140 tactics that we try to get schools to consider and doing around this range. And what I would like to suggest to you is that while this was developed, really out of an Air Force model taken to colleges, this actually is a really kind of spiffy model or a way of thinking about. You don't have to, the details you can work out and fit to every situation, but thinking about these 7 elements and putting them in that circle of strategic planning, seeing what in your system would address these kinds of things is really a kind of nice project. Just want to give you then a couple of 4 minutes worth of overview of the kind of work we're doing. So one of the ways we're trying to communicate with teens, we actually have a partnership with MTV, a website called Half of Us. And it's a library of videos. They're open for anyone to use as long as you give us credit and don't charge people for using them. There are a series of brief videos and public service announcements about mental health, and mostly focused on how are you a friend, help giving. As you see, we've got some, what's a website without some celebrity stuff there? We've got Macklemore talking about his history of substance use and how he's come through that. But there are probably about 100 videos on there that are free to use. We've done a number of resources. We were very involved in responding to the Netflix show 13 Reasons Why. We did 2 sets of talking points as guidance for both schools and parents and young people around how to think about watching the show. It's a whole long story. If people are curious about it, we can talk a little bit more about that. We've got a number of guides and resources, so we try to come in and help colleges when there are areas that haven't been addressed that well. I mentioned Set to Go. It's we think of it as a kind of online textbook for thinking about being emotionally prepared for adulthood. So it's got a series of articles about life skills, about social and emotional skills, mental health and substance abuse literacy, thoughts about why college is important, what are the things you should be considering, a lot of focus on goodness of fit. And one of the things that we're proud of also is that in the transition section, we really want to get people to think about transitioning health and mental health care from high school to college or from their teen years to adulthood, and they're taking responsibility for it. So we've actually got a guide that walks people through those things. I'm going to go through this, as I mentioned before, with Jed Campus. We work with now close to 180 schools over a 4-year period. We basically use this model that I showed you before, that wheel, to help them think through what are they currently doing, what kinds of things can they be enhancing. As I like to say, we're proud of the fact that the participants, and it's in here, but it's not that important, range from Princeton to Three Rivers Community College. So we really tried to be thoughtful about, and I'm not picking on Three Rivers Community, we've got a number of community colleges, we've got actually several medical schools as standalone groups that we're working with to try to think through how do you create a community mental health system on your campus. I'm not going to get into these details. One of the things we like to actually try to practice what we preach. So we believe in connections and connectedness. We find that, we're a lot more impactful. So we've worked with a number of groups like MTV. We're doing a big project, just to let you know. Hopefully we'll be launching with the American Foundation for Suicide Prevention and the Ad Council a social media-based campaign about help giving around mental health issues that will be distributed over Facebook and, all those other social media things. So that should be coming in the fall, so keep an eye out for that. We're excited about that. And I think I'm going to stop here because otherwise we're not going to have enough time for questions. So I hope this made some sense, and it's a pleasure being here with you today, and thanks for inviting me.
So thank you so much, Dr. Swartz, for that presentation. And actually, we now do have time for questions. So we want everyone to be involved. So if you're in the room and you have questions, please write them on the cards that are in front of you and raise them up when you're done, and someone will come to pick them up. If you're online, please as well type in any questions you may have, and we will get to as many as we can. And I also have a few questions here for you, Dr.
Sure.
Dr. Schwartz. So the first one is, to what extent do you think stigma plays a role in preventing high school and college students from getting the help they need? And are you hopeful about efforts to reduce stigma?
Yeah, so I'll tell you, we've, just to even back up before your question, we have more and more used the term stigma less and less. I guess I probably could have said that in a simpler way, but we're using stigma less than we have. One of the concerns that we've really come to over the years is people use that term in a lot of ways. So it can be used about my own attitudes about mental health. It could be used in terms of my expectation of other people's attitudes and prejudices around mental health. And, it seems like it's become such a kind of broad term that we're often not talking about the same thing when we're talking about stigma. So that said, now I'll get to your questions. What we're seeing is that with the group of younger kids, so below 21, It feels as if there is increasing openness to being aware of and talking about mental illness and mental health issues. Partly this has been driven by the number of celebrities who've been increasingly open, people both in the music world, actors, people in the sports world who have become more open about this, and kids have noticed it. So yes, I think it's still hard, and I think you also have to look at some sub-communities. There's certain, sometimes the more tight-knit and homogeneous a community, so certain, strictly religious communities, certain racial and ethnic communities, immigrant communities in many cases are very hesitant around mental health for a variety of different reasons. I mean, some just, don't think of mental health problems in the same frame that many of us might. In many cases, for people coming from various countries, the assumptions about what mental health treatment means are very different from ours. So that's not so much stigma as it is simply fear of what mental health treatment is like. So, I think it is diminishing, but to me, the lack of access to really good care is probably at this point a bigger impediment than for really younger people, than their attitudes about mental illness as a whole. Again, you'll see differences across a very large range, but access to care, I think, is a bigger hurdle that we need to contend with.
Thank you.
Sure.
Which kind of leads us to our next question.
Great.
Do the colleges you're partnered with have on-site mental health services and connections to community mental health services?
Yeah, so the terrain of what's happening in colleges is really dramatically varied. There is no legal requirement federally or in any particular system, although there are specific state requirements for specific things, which I'll explain. Colleges are not obligated to provide mental health services on campus. They're sort of required to some reasonable way take care of their students. That said, most private and public four-year colleges and universities have some kind of mental health system, and they range in depth and breadth from being almost sort of full-functioning health community mental health centers to being very, very skeletal. Now, in the community college world, it's really just beginning to get addressed. By and large, there is a pretty bare bones student support system in place, the ones that are being kind of creative about it. And actually, SAMHSA is beginning to look at this through a national grant program they have. But the good community colleges are coordinating with community mental health centers in their, in their surrounding areas. Most colleges and universities, even when they're providing mental health services on campus, are providing sort of primary care mental health. They're doing shortish term stuff. They're doing case management. They're really working on the things that might interface with students' academic success. So almost every college that can is using community resources, whether it's a training program at the hospital that's part of their university, or the School of Social Work, or a freestanding clinic. It really depends on the setting, but most schools that are in a place where they have access to outside resources are trying to work with those outside resources to deepen their bench of services. Absolutely. Yeah.
Thank you. Is Jed involved in working with colleges post-crisis, especially after the 2005 or so Shin decision out of MIT?
Yeah. So we actually were part of a group that developed a post-vention guide So, and it's a pretty nice guide, although it is focused on college postvention. Postvention, for those of you who are not in this universe, refers to handling the aftermath of a suicide, but it could be applied to other crises as well. If anybody wants to find it, you can either find it on the Jed website, or if you Google HEMHA, which is the Higher Education Mental Health Alliance, and postvention, the first thing that will pop up will be this postvention guide. It's downloadable, it's free, it's about 25 pages. So we were involved in helping develop guidance for this, and we will work with schools a number of times. Actually, we've worked with MIT. And the Shin decision, we don't have time to go into the details, but this was a lawsuit that occurred after a student may or may not have died by suicide at MIT. But we have worked with a number of schools after either a suicide or sometimes, unfortunately, on college campuses, there are these episodes of suicide contagion. So, I mean, this is in the public domain. So we worked with University of Pennsylvania after they had a number of suicides. We've gone to a number of schools in other areas after there have been. Tulane had a number of student deaths and suicides a few years ago. We spent like 2 days going through with them what their response was. We will also work acutely. I mean, we let schools know, and many of the colleges know that if there is a suicide, they can sort of use us as a second opinion on the spot to just kind of talk through what their plans are. So we do that regularly also. Yeah.
Thank you. I have an online question.
Okay, great.
What gives you hope for the future regarding youth mental health? And what, if anything, concerns you about the direction that we're heading?
Well, so I think the hopeful things are the increasing openness of youth to really talking about mental health, to helping their friends, to asking for help. I mean, I think asking for help. I think we are seeing that increase. And there's been this kind of circular irony with that because, as we've made improvements and made progress, I think especially we're seeing this in colleges where rates of use of the counseling services keep going up, which we feel is a success on some level. At the same time, it's putting a tremendous stress on the system, and the counseling center directors are saying, oh my God, rates of usage are going up. And we can't handle it because we don't have enough staff and resources to take care of that. So we're actually seeing results of the educational work that we're doing with young people with that greater openness. I think it really does dovetail with a kind of tolerance and openness. I don't want to use that very charged L word, but a sort of liberal-minded attitude. And I'm not talking about political liberal, I'm just talking about a kind of openness to different points of view. It seems to be making it easier for kids to ask for help. I'm still concerned that we're not able to keep up with the need and the demand. So the big challenges, I think, continue to be systemic, that there's just not the infrastructure in place. We're not training enough clinicians. As tuitions are going up in graduate programs, we're not producing people quickly enough to meet anywhere the need that's out there. And clearly one needs to be worried about where the insurance world and all these things are going, and whether they're going to continue to make it easier to get access to care, or will take a turn towards making it harder, which would be pretty dreadful. Yeah.
Thank you. Sure. What's your assessment of the surveys of high schools assessing student risk?
Well, so I assume we're talking about things like Teen Screen, where a school will go in and use a screening tool to assess whether students might be in trouble. So there are a couple of concerns about that. It's always useful to have information, but it can sometimes drive you into some really tough places. First of all, it's important to remember when you do a screening like this, it's happening at one moment in time. People don't always have their problems at the time that you're asking them about the problems. That's just really one slice of a moment. So it's only giving you a snapshot, and it's very hard to tell a story from a snapshot, right? So that's piece number one. Piece number two is it's difficult to think about doing screenings of large populations unless you can do something about it. So what happens, so the American College Health Association does these screenings, but they're not in a position of having to provide resources for that 10% of students who say they've had thoughts of suicide in the last year. So they can just gather information, and that's fine for them. But if you're a school administration and you suddenly find out that of the 40,000 students in your school, which is not unusual for large state schools, you've got 300 kids who are having active thoughts of suicide, what do you do about that? So you need to figure out, if you're getting that information, how you can respond to it. The third thing that I think is potentially a problem is that these screeners are used as an alternative to consistent vigilance, right? So schools will sometimes think, oh, okay, so we're going to give on October 4th, we're going to give kids a screening tool, and then we can check off the thing that we looked into their mental health. But that's not really kind of dealing with, you really need to have staff and faculty and the people in the school alert to stuff every day, not just on the day you do the screening. So if the school thinks that that is an adequate substitute for, for properly training your faculty and staff, it's not equivalent. It's useful to have information, unless it puts you in a bind, but it is important not to confuse what information you're getting from that screening.
Thank you.
Sure.
You mentioned earlier about the increased usage and burden on the systems in colleges and high schools. Do you have any information about schools using peers to help ease that burden at all?
Yeah. So it's complicated. So there are a number of models out there. Colleges have forever, sort of interested psychology undergrads and pre-social work students have done these peer counseling things, and phone-in lines and things like that on peer bases. Schools worry about those things, first because it takes a lot of work to train the students and to oversee them. And these overnight call-in things at a particular school tend to not get that much traffic, and then the students get sort of bored and stop showing up, and so then it tends to fall apart. There are other models that groups are working with. We just spoke to a group last week that is doing more sort of support, advising, so more of a mentoring than a therapy thing. So that model, or models around psychoeducation that students are doing peer-to-peer, I think schools are more comfortable with. They are beginning to proliferate. Schools have different relationships to them. I think it's better to work with those groups than not, but sometimes the school's attorneys will say, we don't want you guys to get involved with these students because we'll be responsible for outcomes. It's still better to have some oversight and some training. So there are these different models of psychoeducation, kind of peer supporters versus junior therapists. I think schools are by and large not thrilled with the junior therapist role, but definitely the peer supporter and psychoeducation, I think, is something that's beginning to happen more and more.
Thank you. So we have time for one more question. Does Jed have a youth advisory council, and/or do young people guide your promotional and outreach efforts?
Yeah, so the answer to both of those is yes. We do have a youth advisory council. If you go on our website, you can find information about it. At this point, I think it's all college students, but I'm not sure about that because I'm not so involved in it. When we're developing any of the work that we do, so the work we did with MTV, We got a lot of input from young people. From their staff was all young, and take a look. The nice thing about those videos, they're MTV production values in our content, so they look professional. Which it's not easy. It's hard to make stuff look natural. The work we're doing with Ad Council now, we have used focus groups of young people to get feedback along this whole process. We've been developing this campaign over the last year, and have gotten a lot of input from young folks on the ideas for this. Yeah.
All right. Thank you,
Thanks
Dr.
very
Schwartz, for
much.
your time this morning.